Well, now for the second installment of Mitch Bryant's SimLab story, the lab in which doctors over at Spa Memorial Hospital hone their skills before they actually take on real patients in the emergency room.
Well, Mitch now takes us behind the scenes for a whole new look at what it takes to be ready for anything in those high-stress, life-or-death situations.
He was stopped at a stoplight when a drunk driver swerved and ran into him, hit him about approximately 55 miles per hour.
It's a scene these doctors see all too often. A drunk driver slams into another car, and it's the innocent man that winds up in the hospital. For the next few minutes, this is the emergency room. This robot, a real patient, and the risk, life or death. Even some of the scenario's details themselves are based on an actual car crash that the hospital has dealt with in the past.
Hi, sir. I'm Dr. McNeary. I'm going to take care of you today. Can you tell me your name?
These young doctors get straight to work, making the patient comfortable and trying to figure out what exactly is wrong with him. Working as a team, they discover that the man's leg is broken and he is having some trouble breathing.
Let's get 100 of lidocaine, 20 of etomidate, 100 of Stux.
So they get him off the backboard and onto the table where they can begin to treat his obvious injuries. But that's when SimLab coordinator Steve Butler throws a monkey wrench into the works. What the residents don't know is that the patient has begun bleeding on the inside, and there's an unknown bleeding coming from his arm. And as the sheets begin to turn red, the doctors figure it out and switch gears immediately.
We have some internal bleeding the surgeon's called.
Blood bank has arrived with your emergency release blood.
Okay.
With having to make split-second reactions to ever-changing situations, these doctors get the best kind of training in the SimLab, hands-on experience. And with their quick thinking and teamwork, Fred survives until he can be taken into surgery where surgeons will stop his internal bleeding and patch up his severed artery. It will be a common sight for these young doctors in the days and nights ahead of them, but thanks to their training, they will be ready. Mitch Bryant, KRAS 6 News.
Now, we're told that Spa Memorial has a handful of those robots, and residents practice a mystery scenario every single Monday to be ready for anything that may come through the doors at the emergency room.